Welcome to Wadadlivity, where Wanderlust meets Afro-Caribbean wellness. Today we're at Dawn Soleil Cafe in Bay Gardens and I'm sitting down with Tanya Ambrose, a founder of Scrub Life Cares, a non-profit organization that's determined to break taboos about menstrual care and reproductive health. Tanya, thank you so much for joining us this morning. I'm really excited to learn more about Scrub Life Cares and to share the organization's mission with Antigua and the rest of the world.
Thank you for having me. It's always a pleasure being in your presence.
Okay, so let's start off by talking about Scrub Life's mission. What is the mission behind the organization and why did you start it?
So I think I'll go back to why I started it and we'll come to the mission.
Okay.
So when I first migrated many years ago out of Antigua to pursue my tertiary degree, I said, you know what, I want to give back to Antigua in some way, shape or form. Because I was a girl guide, working in the church, so we were always giving back in some way, shape or form to the community. But I thought I had to be a millionaire. I'm not there yet. I'm on the way sometime soon.
Yes, speaking it into existence.
Yes. But I did a study abroad in Uganda, Africa in 2019 during my undergrad when I was doing my Bachelor's of Science in Public Health. And I remember we were doing some research in the slums and I saw a young lady running down the street and she was bleeding between her legs. And my first thought was, did somebody rape her? Something bad happened to her. And I remember like a couple of hours after, my professor told the class that, you know what, she just couldn't afford her menstrual product. Because we were taking menstrual products and some gently used clothing to the slums of Uganda. And I said, wow, I said, people can't afford, menstrual products. Me come from my place of privilege, I didn't know that was a thing. And then, me being the public health person, I decided to go back to the guest room that we were staying in the guest house and I was doing my research and came across period poverty. And at the time in 2019, they said that it was 500 women and girls who were experiencing period poverty globally. I was like, wow, that's a significant number.
So what is period poverty?
So it's a lack of access to menstrual products, to any sort of wash facilities. So that's, any access to water, or even struggling or not being able to afford the menstrual hygiene products. So with that, individuals facing period poverty, they either use the products longer.
Okay.
So then that ends up, getting some sort of infection because now you're bleeding. And imagine if you have a heavy cycle and you're wearing the products for a long period of time.
Right.
And you should be changing like every 2 hours. So ideally they'll wear the products longer or they'll use like, toilet paper or tissue paper or socks or even leaves in some parts of the world as well. So I decided, you know what, let me decide to do something about this because I, again, come from a place of privilege, not understanding that people will struggling to even afford menstrual products. And me now in this line of work, I'm like, oh, I'm going to the grocery store and I'm like, oh my goodness, $10.99 or $13.99 for a pack of pads. So I can only imagine individuals, let's say you're not even making enough money. So I decided to form Scrub Life Care. So I did the research, did a non-profit elective in school as well. So I was going to school and had to build a non-profit class as a part of the project for the class.
Okay,
and so I built Scrub Life Care. And of course, we've since niched down even more, but we were going to do like, back to school items, show other social services as well. But I'm like, you know what, let's focus on reproductive health because that's kind of where my specialty is as a public health professional. And we launched in 2020 in the middle of the pandemic. Don't ask me why. Every day I think about it, I'm like, why would I launch something in the heart of a pandemic? We had no idea what we were experiencing at the time. But again, pandemics don't stop periods.
Exactly.
Disasters don't stop periods. And I remember putting a flyer out and asking people for, menstrual and hygiene products and non-perishable food items. And the response that I got at the time, we didn't have a name. It was just me. I had a blog, and we were just, accepting items. And the response from people across the world, ideally, I was like, this can be something. So let me go ahead and form the nonprofit. And so the name, ideally, because I was a certified nursing assistant, and all I wore was scrubs. I had nothing else in my closet. I mean, of course I had jeans, but all I wore every day was scrubs. I'm like, okay, I'm wearing scrubs and I'm caring for life. So I kind of like put the name together. Like, what, Scrub Life Cares.
Right.
So that's kind of where the name came through. Oh, what are we scrubbing? Like, nothing, what, we're just taking care of people,
right.
In their day-to-day life as well. So that's the idea behind Scrub Life Care. So then we've since niched down to focus on reproductive and sexual health. So our mission is to increase access to reproductive and sexual health education, comprehensive reproductive and sexual health education, and of course increase access to menstrual and hygiene supplies to individuals in needs in Antigua and Barbuda, in the southern United States, and across the Caribbean region as well. So we are 5 years in and still stressful. But we've seen the impact and we've seen an increase in growth and people actually becoming more open to talk about the conversation as well. And I will say, even doing the work, several years ago, I said to my team, even though we're addressing period poverty because we know about it and, working towards advancing menstrual equity, which meaning, everyone can have equal access to these products, do we have the issue here in Antigua?
Yes.
And of course, being public health professionals, we had to go and do our research. And we did, some research and found that, people are experiencing period poverty in Antigua. But again, because of the taboo and the stigma and the shame that comes with talking about your periods or even talking about sex or even reproductive health issues, it's not being talked in the open enough. So through our qualitative research, we've been able to identify that there's different areas in Antigua that people are experiencing period poverty. So for us now, we're able to expand our product distribution program where we can, deliver items to individuals every quarter. And we're hoping to increase that access, in September of 2026.
Okay, yeah, that's really great to hear that. One, you're doing qualitative research because, in general, in Antigua and sometimes in the broader Caribbean, that first-hand data is often lacking. A lot of times, we see a lot of reports about African countries or North American countries, but very rarely do we have data that's specific to our island. So it's really great that your team was able to go out and get that information firsthand. Can you tell me a little bit more about the qualifications of the other team members? Because I know it's not just you running Scrub Life Cares.
Yes. No,
Can you tell me a bit more about the board and, the different backgrounds of the people who are involved?
So here at Scrub Life Cares, we've been blessed to have a wide variety of individuals across the healthcare sector. So we have medical doctors, nursing, teachers, and we have other members of the civil society as well. And for us, we pride ourselves on having these individuals because, you want people who understand.
Absolutely.
One, you have the lived experience as a woman. We do have one male a part of the organization, so he's been able to experience what it feels like or what it means to be a supportive person in the lives of individuals who menstruate or, women who have other reproductive health issues as well. So I think for us, I am very blessed as a founder to have these people in our corner. As far as, you have doctors who are part of the board, teachers, nurses, public health practitioners. It doesn't get better than that when you think about it.
Absolutely.
Yeah.
In terms of some of the stigma and taboos that we have around menstruation and reproductive health, in Antigua and Barbuda and in the Caribbean, again, it's still very much a taboo topic. People don't really discuss periods. Even within our schools and education systems, sometimes a lot of the crucial information is glossed over, or you're just told to read a chapter in a certain book and it's very abstract. There's no real life, innuendo or experience that's shared. How are some of the ways that you have been able to break through some of those taboos and have people in the communities open up more about their experiences, about period poverty in particular? Because sometimes, there's shame around periods and then there's shame around poverty and not having access to resources.
So I would say as Scrub Life Cares, we pride ourselves in ensuring that the individuals who we're serving is done with care. So the community is always at the center. So even if you're experiencing period poverty or you're struggling to afford the menstrual products, because people are across the world and even in Antigua, they're choosing between a utility bill, food, or to buy period product. And I'll give you an example. I was in Epicurean here in Antigua the other day, and someone said to me, "Are you the period lady?" And I said, "Okay, I'll take that. I mean, it means we're doing something, right?"
The promo is
working. And she said to me, "Oh, look at me here. I'm buying this 1 pack of pad for me because I'm on my cycle this week, but my daughter's going to be on her cycle next week, and I can't afford the products to her." And I could commend her even saying that to me. So we were able to give her and her, her family, her daughter, supply to last a quarter ideally. So, sometimes we word them out, but for us, when you look at the conversations around period poverty or even periods, it's so taboo. People don't want to talk about it. So they don't want to ask for help. It's like, we're here to give you the help. We want these products off our hands, right? We're here to help you. And what we've seen is that we've gone into the schools and we've had teachers. This is why, again, we're working towards ensuring that the teachers are trained to have these conversations, because we've had students ask certain questions when we do our workshops. Because you go in with the mindset to give the education at an age-appropriate level, and then you have a question that's left field. Like I had a student one time ask me, what happens if you get raped and you get pregnant? And I had a teacher said to me, "Ma'am, don't answer that question." So that is the issue that we are seeing as an organization within our school system and the school structure. Because like you mentioned, we're glossing over some of the topics. They've said to me, "Oh, we have this in our curriculum." And then when you look at the curriculum, while there's certain things there, it's still the basics. We need to evolve in a sense where we have different students now. Back in our time, we hardly had cell phones. Like I had my first cell phone in high school, right? And we were shut off from certain things in the world. Now we have access to TikTok and Instagram and Facebook. So many different things you can just Google. Even AI can tell you certain things now.
Yes.
And when we gloss over certain topics, it brings more stigma and shame because again now students are doing things that they shouldn't be doing. And then, an individual will get their period and you hear their mom say, oh, don't get pregnant. So we're skipping a whole process between period and pregnancy. We're skipping a whole education session there. And I think for us, we want to ensure that the conversation becomes more open. And I think through our initiatives as it relates to our Health Expo and even our workshop sessions, in the beginning, they're very timid and they don't want to talk about it. And by the time you're ready to leave, they don't want you to leave because by now they realize, you know what, I'm not being talked at, you're being engaged in your own learning process, if that makes sense.
Yeah, absolutely.
The days of, oh, don't do this or abstain or you shouldn't do that because this is what's going to happen. You want them to feel included in their own education, in their own learning, to see where they are developmentally, of course, but also where they are in their mind to see, okay, what have I learned outside of my household, outside of school? And then that way you tailor your education based on that.
Right. So you mentioned age-appropriate educational sessions and everything is science-based, data-based. Can you tell me about the age range of clients that you're serving in the community? Or is there a range?
Well, ideally, we'll say from ages 8 because our young girls are seeing their periods from ages 8. And it goes beyond periods and even puberty because, again, you want them to be able to make informed, healthy decisions, right? Mm-hmm. So we've had individuals who are 5 years old. Who we've had workshops with, who've come to our events, who parents say, my 5-year-old is asking about certain private parts and I'm scared to talk to them about it. So then we're having that conversation at an age-appropriate level because, again, we have a team who are, doctors, nurses, they work in these areas. Some of them have expertise in adolescent health, so that helps as well. And we even want to educate our parents. Like, how do you approach certain topics with your child or children? Because, again, in the Caribbean, talking about sex, talking about periods, talking about pregnancy, it's still taboo to some extent. And we want to educate not only our students or our younger population, but also our parents and our younger adults about what it means to, raise a generation or raise a child who's self-aware. Mm-hmm. We've had students 12, 13, I have heavy periods that my parents won't listen to me. They say it's normal.
Right.
And on one hand, I can understand because when I was going to high school, we had a classmate that every time she was on her cycle, she would not come to class. I would just say, no, that's her period, that's okay. We normalize it. But obviously, as you grow and you learn, you understand, that's not normal.
Right.
So wanting to educate them. So there's something for everyone. Like I said, the youngest we've had has been 5 years old, but developmentally, children from 3 and stuff, they start noticing, mommy and daddy have different paths. What does this mean? And we want to be able to foster that conversation. So it can be wholesome, holistic, but also at a level that they understand. It doesn't have to be mean.
Right.
Or it doesn't have to be demeaning, or it doesn't have to be stigmatized. Because you know what? It's their body part. They're going to grow. They're going to develop. So you want them to be able to have that understanding so they can make that, informed decision as they get older.
Okay, great. So it really seems like you're fostering a lot of self-awareness, self-love, self-advocacy from a very early age.
Yes.
And that will help because we know as girls and eventually grow into women, advocacy becomes extremely important, especially as they move into the reproductive years.
Yes.
Can you tell us about some of the most critical or the most pervasive reproductive issues that have come up in your seminars or work groups?
Yes, so what we've seen is individuals talk about PCOS, which is now PMOS, and I'm failing to remember the term. But PCOS, and there's endometriosis or PMOS, endometriosis, and we talk about fibroids. A lot of individuals, are experiencing endometriosis. Like I mentioned, that classmate that we had in high school, turns out later on that she ended up having endometriosis. People don't know this because, again, her period pain is heavy, it's heavy, her flow is heavy, her pain is severe. That's her period. That's not normal. She's soaking through her menstrual product, every hour. That is not normal. So we want to ensure that individuals are able, she has heavy period. That's something to do with fibroids. How can we advocate for ourselves? Because, when you go to see a doctor sometimes, the time frame within a patient and the provider is very limited.
Yes.
That's just what it is. You're paying all this money, but at the same time, you can only see them for 20 minutes.
So 20 minutes is long.
Sometimes 20 minutes is long. So 20 minutes is long, but you're not getting your questions answered the way you should. So we want to be a bridge where, you go to your doctor, they explain certain things to you, but you may not understand either, right? Because sometimes they're using terms forgetting that, I'm somebody here that I am trusting you to educate me So when you're using terms, I'm not leaving your doctor's office wondering, oh, what was that about? What did he say? That I'm here Googling, and Google's going to tell you something else.
Yes, you're on WebMD and now you think it's the end of the world.
The end of the world. So we really want to be that bridge that we can say, okay, you went to your doctor, you understand to an extent, but you know what? I came to a webinar or a workshop with Scrub Life Kids, and I was able to get it broken down in a way that I can understand as well.
And
so,
again, by professionals who are trained.
By professionals who are trained in these areas and understand, not everyone is going to understand how I'm speaking in my medical term, Right. So, so we've seen a lot of issues as it relates to fibroids now in most of our young women, which is has been increasing, not only in Antigua, but across the globe as well. The endometriosis as well. Sometimes it takes a while to be diagnosed, and that's what we've seen as well. So we're just encouraging individuals to advocate for yourself. You should know your body, because your period tells you stories. Like we call it the fifth vital sign. So it tells you a lot about your body, ideally. So we want people to be more aware. As I said, become more self-aware. As you get older, you may have a heavier flow. When you were younger, you may have had a heavier flow. Now it's lighter, or as you were getting older, it's heavier. What's causing these changes,
Right.
So definitely want to be able to be aware so you can advocate for yourself with your healthcare provider.
Okay, that's really great. And then I know we talked a lot about menstruation and reproductive care. Do you have any support as of yet for like perimenopause or menopause, or is that something that you think you might touch on later on, if at all?
We have touched on it, and it's something that we're integrating into our programs as well. When we did that research as well, I was mentioning earlier about the menstrual health of Antigua and Barbuda as far as period poverty. We had a group of older individuals who attended the event as well, right? And we had a whole session about perimenopause and menopause that was well received. So even going forward, even now, we often say again, we have these trained professionals from mental health to nutritionists to doctors, nurses in our organizations that we're not realizing again, individuals as young as 35 is experiencing perimenopause. Are we not talking about it?
Again, the taboos.
The taboos, we're not talking about it. Or sometimes we skip perimenopause to go to menopause when there's a whole phase in between that as well. So we have been incorporating that into our sessions depending on who we're speaking to. And just fostering a more, we're saying now, period-friendly world, period-friendly Antigua and Barbuda, but also more supportive environments in the workspaces and in our schools as well to foster individuals, going through reproductive health issues. But not only that, your menstrual cycle, my 40% today is my 100% that I can give to my employer, right? I want people to understand, as menstruating individuals, you're not going to get the same person every day. So I think,
and that's okay.
Yeah, and that's okay. You shouldn't be penalized as a result of that. So we're definitely working towards going from a holistic, whole person perspective, ideally.
Okay, great. So I know you have a lot of grassroots initiatives. You mentioned the pantry that you have.
Yes.
How can persons access resources? So you mentioned, it's still taboo. Maybe people are not going to run into an Epicurean.
Right.
How can they get in touch with Scrub Life Cares if they are in need of these resources?
So we're on all the social media at Scrub Life Cares, or you can email us at info@scrublifecares.org to request menstrual products. Like I said, we give them to you so they can last every quarter versus you having to come back every month, because that shame and stigma is still there. We don't want individuals coming every month to feel, here I am, again.
Right.
So we give you enough to last every quarter. That's the model that we're using right now. And eventually we can increase the distribution program across the entire Antigua. But right now, we have certain areas. But if you are in need, you definitely want to reach out to us so we can ensure that you're on our list of distributors, so we can give you the products and the hygiene supplies that you need. Because they're expensive. I complain too. Yeah. I go to the store and I'm like, why is this? I'm getting 12 pads for $20-something. It doesn't make sense. An individual can go through 12 pads in an entire week.
Right.
So definitely, reach out to us, and we would definitely love to help, because, we've been building different partnerships that's now allowing us to increase our distribution program.
Okay. And then in terms of the actual menstrual products that you provide, and in general, what are some of the things that we should be looking out for in safe or clean menstrual products? Because we hear a lot now about, all the chemicals that are in some of the pads and menstrual products and feminine care products. What should we be avoiding? What should we be looking out for?
Some of the products that we are using now, unfortunately, they are filled with chemical disruptors, and the ingredients are failing me, which is crazy. But therefore, it's important for us to read the ingredients to see what's in there, so we can ensure that it's not necessarily causing an allergic reaction to us. Some of these products also help to cause other reproductive health issues, because again, you're wearing them for a longer period of time, or you don't even know what they're being used for or being processed in, right? Also, we do understand that if you're experiencing period poverty, having to buy organic products you're already choosing between a utility bill, food, and your
And
menstrual
these supplies,
product.
yes.
Thinking about having to choose organic products now, that's also even another challenge or even a barrier for some people. So again, for us, over the next couple of months, we just, about to sign on to a partnership that we are going to be providing clean and organic products to individuals that we serve here. Because again, we think about everything. Again, sometimes when you're in immediate need, you're not thinking about what ingredients is in this product.
It's
I
like,
just need
I
the
just
product.
need something now.
Yes. And it works, but now we're seeing individuals experiencing cervical cancer, so many different things as a result of some of these period products. So we're making it a mission for us here at Scrub Life Care to ensure that we are providing organic products, but also think about the environment, and from a sustainability standpoint, it's still taboo to talk about periods. So when you think about menstrual cups or menstrual discs,
Yes.
when you're introducing that to a society that don't even want to use tampons.
Right. And can you, for those who don't know, can you explain what a menstrual cup or
So
a menstrual
a
disc
menstrual
is?
cup is a reusable menstrual item that you can use. So it's kind of like a tampon, where I wish I had one, but you can fold it and you insert it into your uterus, right? Into your vagina, and then it suctions in your uterus, so it's gonna catch your blood. So it can last up to 8 to 10 hours.
Right. So that's a much more cost.
So that's a much more cost effective. It's a little bit underpriced, you said, depending on which brand you go with. But I mean, once you invest in that, at least I think the most expensive one maybe up to $30 US, if I'm not mistaken. But
And how long does that last you?
at least a couple of years, at least 5. Some can last 5. It depends on which brand again. 5 to 10 years. So imagine you're saving thousands of dollars if you were to invest in a menstrual cup
or
disc. But then also we have gotten the reusable menstrual underwear as well. So individuals who may not, you're still, may feel icky about, touching yourself, because again, that's a real thing as well. You can invest in the menstrual underwear. They have the reusable and the disposable one as well. So then that of course is more important. You can get it, you can wash it, but then you think about access to water as well.
Exactly, yes.
That's another thing. But then even for individuals who have younger children who are experiencing a period, you think about individuals who are differently able and neurodivergent.
Yes.
The reusable or the disposable menstrual underwear is what we'll use for them as well. So we've been distributing those as well to those in that community, because again, periods, disability does not stop a period or any sort of reproductive health issue. So we've been able to give them the reusable or the disposable menstrual underwear as well. And even as adults, you can wear them as well too. But again, you just find other alternatives that what works for you.
So pretty much what works for you, exactly.
Yeah.
So we talked about pads, tampons, menstrual discs, menstrual cups, underwear. So there's a broad variety of
things available
products
now. Yeah.
available, and Scrub Life Cares is here to help you navigate which options might work best for you given your personal preference, your financial situation, your day-to-day routine. So there is something for everybody. You just need the right resources and the right help to find that. Now, we talked about your school outreach, we spoke about people finding you online, and of course, probably your best known event is your annual Grow with the Flow Wellness Expo.
Yes.
Tell us about that event. I know you're approaching your 5th year now. Congratulations.
Thank you. Can you believe it? That is crazy. When we first started this event, I just knew we wanted to bring health education to Antigua and to make it fun about learning about your bodies. Again, in a society that talking about your bodies, talking about sex, talking about your private parts is taboo. We had no idea what we were doing about event planning. Probably still don't, maybe. Who knows? Well, I'll let the audience tell us. But I said to myself, if we have 15 people in attendance, that would be a success. And that first year, we had 78 people at the event. Again, we had no idea what we were doing with decorations. We just knew we were going to bring health education to Antigua, but make it fun. And then over the years, we have seen significant growth. Year 4 being our biggest growth to date, with almost 400 individuals now.
Wow,
So now,
amazing.
we weren't anticipating that in year 4, I will tell you that much. And year 5 now, we have to now anticipate that amount, because again, people are coming and it's not only just learning, but it's an immersive experience. And I think for year 5, we are very intentional about, including everyone, but also ensuring that, when you come, you're not only learning, but you're getting, and it's like a fete for health education. So there's a nice little vibe. The entertainment is good. The games are going to be good. Again, you're learning with the different partners that we have. They're going to be educating you, but you're going to be, getting more hands-on. So you're not coming to be talked at,
Right.
So definitely excited about that. And this year we've added the maternal health component.
Nice.
One of the reasons I did that too is because, I'm a maternal health specialist.
Yes.
And then I was listening to something, I think it was a budget speech in Antigua in Parliament one day, and they said that I can't remember the number, it might have been 19 or 20-something% of people are receiving antenatal care. So that's, care when you're pregnant. And that number is extremely low.
Yes.
Especially when we have different clinics in Antigua. So, what, that can't be. So we want to add that component so people can get the education, but also know what's available to them in Antigua as well, so they can go and get the right care.
Yes.
So we can, reduce and not even increase. We don't want to increase maternal mortality or even infant mortality either.
Right.
And then this year we're adding a neurodiversity and differently able sector as well, because again, reproductive health doesn't stop at individuals who are neurodivergent or differently able. So we want to have that as well, so we can be inclusive, and that's very intentional. This time around, it shouldn't have taken us this long, but it did. But nevertheless,
it's only year 5.
Listen, like I said, we had no idea. We didn't know what we were doing event-wise, but as you live and you learn, and you also understand, how things are in this world, in society. You want to ensure that everybody can feel welcome, and we're looking forward to year 5. It's I would say it's one of the least stressful years of planning. I hope I won't come back myself saying that, but it's one of the least stressful years of planning, because now we kind of have an idea of what we're doing event-wise, and we've had some different sponsors, old sponsors and then newer sponsors this year who've really come on board because they believe in the mission. So we are looking forward to that. Looking forward to having you as well. So
yes, it's always a pleasure.
That's always important to us, and we do cherish you at Scrub Life Cares.
Thank you.
Yes.
So for those who haven't been to the event, it's a really good event for the whole family. I have a son. I brought him along to the event in the past because it's also important for our boys, our young men, to understand, what their female family members and counterparts are experiencing, and again, to help get rid of some of that shame around menstruation and reproductive health, because once we can all come together and create a supportive community, it benefits everyone. So if you're ever in Antigua in May, make sure you do check out the Scrub Life Cares Grow with the Flow annual event. What are some of the other ways that people can catch up with what you're doing throughout the year, not just at Grow with the Flow?
Yes, you want to stay tuned to our social media, especially our website. We've been very active on the website. We do our best to post everything that we possibly can. Our blogs, I don't think we posted our calendar of events here because there's so many things happening as we celebrate year 5. But definitely stick to our social media, and of course, go to our website and sign up to our newsletter. There's always something that comes out every month, so you know what's happening or what has happened or what will be happening. And other ways you can get involved. If you want to volunteer, again, reach out to us via email or on our website, because we're always welcoming our students and other community members to volunteer to a worthy cause.
All right, Tanya, thank you so much. This was really enlightening. I hope our viewers find this information very useful and some of them feel inspired to volunteer and do their own research. I really appreciate the work that you and the Scrub Life Cares team is doing, and amazing job.
Thank you. Thanks for having me.
Oh, Wadadlivity, feel the vibe. Stretch your soul, let your spirit thrive. Wellness calling, step inside.